Know your medical scheme option in 5 minutes. BestMed's Beat 1 factual tutorial is brought to you by CureMed Healthcare Consultants, a registered financial services provider and accredited with the Council for Medical Schemes. For more information on CureMed Healthcare Consultants, visit us on www.curemed.co.za. Your medical aid is categorized into two main benefits. The first one being your risk benefit, which includes hospitalization, the treatment of chronic conditions, and serious illnesses. Your day-to-day benefit includes everything that is not covered in hospital, such as GP's consultations, medications, dentistry, etc. The breakdown of your high-risk benefit includes private hospitalization, serious illnesses, and the treatment of chronic conditions. Your high-risk benefits are regulated by the Council for Medical Schemes and the Department of Health. All medical aid options should include a list of benefits, better known as the prescribed minimum benefits, to their options. For more information on the prescribed minimum benefits, you can visit the Council's website on www.medicalschemes.com. The prescribed minimum benefits includes 270 medical conditions and the treatment of 25 chronic conditions. The medical schemes, however, are allowed to choose their own designated service provider and formulary to treat these conditions. Let's get back to hospitalization. Hospitalization can be defined as having a bed and a bangle and ordering some yummy food from the hospital's menu. When you are an outpatient, this is not classified as hospitalization, neither when you visit the radiologist for an X-ray. When you are admitted to hospital, you need to contact the medical aid for an authorization number. The number to contact is 0800 220 106. Take a minute of your time and save this number on your cell phone for future reference. In the unfortunate event of being transported to hospital by an ambulance, you need to contact BestMed's designated service provider, ER24. Their contact number is 084 124. Again, take a moment of your time and save this number on your cell phone. Your emergency medical transport is only for emergencies. This benefit is via land or air. If you are unable to contact ER24 because you are not conscious, or if your emergency does not allow you to, you need to contact them on the first available day after the emergency has occurred. While we are talking about ER24, ER24 also provides the international travel cover on your BestMed Beat 1 option. This cover is valid for 90 days up to 10 million South African rands for emergency medical treatment and evacuation. You need to contact ER24 prior to your travel because terms and conditions do apply, and it might be necessary for you to take out some additional travel insurance. Back to private hospitalization. Your cover on BestMed Beat 1 is unlimited at any private hospital at BestMed tariff. It is important for you to note that most specialists charge above medical aid rates. We therefore recommend that our clients take out additional cover to ensure no financial shortcomings. It is called gap cover, and you can obtain the gap cover through CureMed Healthcare Consultants. Co-payments on your BestMed Beat 1 option is 2,000 Rand for endoscopic investigations if it is done in hospital. The scheme waives the 2,000 Rand co-payment if you do your endoscopic investigations in the doctor's rooms. Exclusions on your Beat 1 option is joint replacement surgery, except if it is part of a prescribed minimum benefit. You need to take note, even though your procedure might be authorized, there are limits that apply to all procedures. Contact BestMed on 0800 220 106 to pre-authorize your hospital admission. Next, we will be looking at how BestMed's Beat 1 option covers your serious illnesses. Although you are not hospitalized for oncology, dialysis, hemodialysis, and HIV/AIDS, you have unlimited benefits for the treatment of these illnesses. They are subject to treatment programs and protocols and need to be pre-authorized and approved by the scheme. You can contact the scheme on 0800 220 106 to obtain pre-authorization for your serious illness treatment. Finally, under your high-risk cover, we will be looking at how BestMed's Beat 1 option covers your chronic conditions. 26 chronic conditions are covered by BestMed's Beat 1 option. They include asthma, bipolar mood disorder, cardiac failure, chronic renal disease, epilepsy, HIV/AIDS, hypertension, multiple sclerosis, and schizophrenia, to name a few. Have a look at the screen in front of you and see if you suffer from any one of these diseases. If you do, you may benefit from applying for chronic treatment on BestMed Beat 1. Register your chronic condition by phoning BestMed on 0860 002 378. Your chronic condition is covered at 100% of BestMed tariff, and you may utilize any pharmacy. This is subject to BestMed's formulary and medicine reference price. A 35% co-payment will be imposed should you use medication that is not on BestMed's formulary. That concludes an overview of your high-risk benefits. We will be having a look now at how BestMed Beat 1 covers you on day-to-day. Beat 1 is a hospital plan, therefore you self-fund all day-to-day expenses. The scheme, however, allows 2,100 Rand for wound care treatment per family per annum. BestMed has included preventative care benefits on the Beat 1 option. One flu vaccine per beneficiary per annum is covered. Pneumonia program is available for children under the age of 2 years or high-risk adults, which is identified by the scheme. Pediatric immunizations is done according to the state-recommended program for babies and children. Female contraceptives is limited to 1,300 Rand per family per financial year and includes all items classified in the category of contraceptives. The back rehabilitation program is applicable to beneficiaries who have serious spinal or back problems and may require surgery. The scheme identifies appropriate participants for evaluation at the DBC Centre. Based on the outcomes of the evaluation, a rehabilitation treatment plan is drawn up and initiated, which lasts approximately 6 weeks. Biometric screening includes a glucose test and a cholesterol test, both being the finger prick test, blood pressure and body mass index. The biometric screenings are available from selected Clicks and Dis-Chem pharmacies. The maximum benefit amount is 95 Rand for the screening. This concludes the tutorial of BestMed's Beat 1 option. Visit CureMed Healthcare Consultants at www.curemed.co.za. We have offices in Gauteng, Western Cape and KwaZulu-Natal. We give independent, quality and personal advice. Contact us for medical schemes and gap cover. Welcome to CureMed. You are